Hi, my name is Sue. I am here to do your dressing change today. Can you give me your name and date of birth? Okay, that matches. Good. Well, I checked your orders. I understand that you have a stage 2 pressure ulcer on your left hip, and we're going to be changing that dressing today. Are you having any pain today? You're good? Well, I'll get you situated here, and I'll get all my things set up, all right? I'm going to wash my hands. And I'm just going to raise your bed to a comfortable working height for me. And I'm short, so that's probably good. All right. And let's get your hip exposed. Looks good. Put my bag down here. And the first thing I'm going to do is remove your old dressing. Have you had this dressing change done before? If not, I'll kind of talk you through it. You're not having any pain, are you? Okay, I'm going to use counter traction to remove your old dressing. And we'll dispose of it in the wet bag. All right, and we'll set up our two by twos. I'm going to go ahead and open my hydrocolloid so that I have it ready. All right, and the first thing I want to do is assess your wound, okay? It's looking pretty good. I know it's a stage 2. It's got some superficial loss of some skin. It's not too deep. But let's take a measurement and make sure that we're filling in. Okay, and here's my disposable measure, and it's 1.1 by 1.1, relatively superficial in depth. It does have some surrounding redness, about 1 centimeter surrounding the entire circumference of redness. Throw our measure away. If possible, we would wash our hands at this time. We're going to get ready to clean the wound. I checked my solution. It is not expired. And I could lip it, but remember this is a non-sterile technique, so I don't have to lip it. What I'm going to do is I'm just going to take my 2x2, place it in the palm of my hand. Clean technique, not sterile. So these are just clean gloves, not sterile gloves. And I'm going to cleanse top to bottom. And I'm just going to gently cleanse this wound. And I'm just going to dry my wound top to bottom. Okay. Now I'm free to put on my new hydrocolloid. So I'll take this. And I'll apply it gently to the skin. And I would label and date it. Put my bed back down, clean up my supplies. And document how my patient tolerated the procedure. Make sure he has his call bell and that he's comfortable and he doesn't need anything.